Hello, welcome back to the channel. Today's news might leave you with a lot of questions about our healthcare system, immigration, and how things are being handled, or not handled, on the ground. Please watch till the end so you can hear where the news comes from and try to verify it yourself. So, this one happened at a public hospital in Limpopo, where 15 pregnant Zimbabwean nationals were reportedly chased out after allegedly entering the hospital in secret to access free health care. Yes, 15 pregnant women, undocumented and allegedly bypassing security protocols, walked into the hospital hoping to receive maternity care without any legal documentation or appointment bookings. According to several healthcare workers on duty that day, the women arrived in the early hours of the morning, blending in with other patients already in the waiting area. But suspicion quickly arose when staff started noticing that the women weren't recorded in the hospital registry and didn't have any clinic cards or South African ID documentation. Security personnel were eventually called in to investigate, and it was discovered that all 15 of the women were undocumented migrants from Zimbabwe. Hospital management then made the decision to escort them out of the facility immediately, citing both legal regulations and overcrowding as reasons for the action. Some sources close to the hospital even said that the maternity ward was already stretched beyond its limit, with South African citizens already waiting in long queues, many in advanced stages of labor. Now, this isn't the first time we're hearing of foreigners attempting to access healthcare through the back door. Health workers in border towns like Messina, Polokwane, and even parts of Gauteng have been crying out for years, saying that they're overwhelmed by undocumented patients, particularly pregnant women who wait until the last minute to seek urgent care. This issue goes deeper than just a hospital policy or a security oversight. South Africa's healthcare system is already stretched to the breaking point, with limited budgets, overworked staff, and ongoing infrastructure challenges. When you add the additional burden of undocumented patients who can't be billed or traced, it creates frustration, not only for the staff but also for the local communities who feel they're being pushed to the back of the line. Some South Africans have taken to social media in anger, saying their tax money is being used to fund healthcare for people who aren't contributing to the system. One frustrated user posted, "We wait hours for a doctor, but people who don't even belong here walk in and expect royal treatment. Where is the fairness in that?" Another simply said, "Let's fix home before we fix the neighborhood." The Department of Health, meanwhile, continues to walk a tightrope between constitutional obligations and practical limitations. The Constitution guarantees access to healthcare for everyone, but when that noble principle meets the harsh reality of underfunding, staff shortages, and political silence on immigration controls, something has to give. Reports also suggest that there are syndicates operating near border towns that coach pregnant women on how to slip past authorities and reach hospitals. Some even pay small bribes to gain access to facilities, which makes the problem even harder to trace and control. It's not just about healthcare anymore, it's a national security issue, a budget crisis, and a ticking time bomb if not addressed properly. As for those 15 women, it's unclear where they were taken after being removed from the hospital. Some might have gone to private clinics or back across the border, while others could be trying again at a different facility. The Department of Home Affairs has not released any statement on this incident yet. Make no mistake, Mzansi, this is not just a healthcare problem. It's a reflection of all the cracks in the system. Until real action is taken to properly regulate border control, address documentation loopholes, and invest in the public health sector, we'll keep seeing scenes like this playing out again and again. Let us know what you think down in the comments. Should hospitals turn undocumented people away? Or should South Africa keep its doors open, even if the house is full? All the images used in this video are for illustration purposes only. Please don't forget to subscribe if you haven't already, and stay tuned for more verified news updates. And just to end on a light note, if our border was a WhatsApp group, someone needs to be removed, admin must wake up. Stay safe, and see you in the next one. Sources: Daily Dispatch, ENCA, Sunday Times, VUV News on Facebook.